Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Today, over 6,000 health workers in Africa infected with the coronavirus as ratio of doctor to patient in Nigeria raises concern. More on coronavirus awareness as WHO, under its Health Emergencies Program in the Northeast, donates over 400,000 copies of information, education and communication materials. And Spain mourns victims of coronavirus pandemic. The Nigeria Center for Disease Control, NCDC, says the country recorded 643 cases in the last 24 hours. The new cases were reported in 18 states and the Federal Capital Territory, with Lagos having 230 infections, almost one-third of the total number of the new cases, while Oyo State has 69, the FCT 51, Edo 43, Osun 35, Rivers and Ebonyi 30 each, Kaduna 28, Ogun 27, Ondo 23, Plateau 20, Benue 17 cases, Enugu 16, Imo 10, Delta 6, Kano 4, Nasarawa 2, and 1 each in Kebbi and Ekiti states. The latest confirmed cases brings the total number of cases in the country to 34,259. Across the country, 13,999 patients have been discharged, and the death toll stands at 760 after the center recorded 6 deaths last night. The coronavirus disease outbreak continues to grow in the African region since it was first detected in Algeria on the 25th of February 2020. According to the World Health Organization, COVID-19 African External Situation Report 19, health workers in Africa have been significantly affected by the coronavirus, with 8,036, 20%, being infected in 40 countries. Since the beginning of the outbreak, overall, South Africa has been the most affected, with 3,583 health workers infected, followed by Nigeria 987, Cameroon 593, Ghana 421, Guinea-Bissau 239, Niger 184. Côte d'Ivoire has 179, Malawi 160, Democratic Republic of Congo 158, Sierra Leone, Senegal 157 and 147 respectively. It also lists Niger and Guinea-Bissau as the highest country-specific proportions of health workers at 184 to 1,094 of Nigerians, and then in the case of Guinea-Bissau, 239 to 1,790 Guinea-Bissau. Over in Nigeria, while the Presidential Task Force has confirmed that over 812 health workers have contracted the virus, more information from the resident doctors say the total doctors confirmed to have the virus are 268. And NARD says that 13 have died as at 14th of July 2020. The association gives figures of all the resident doctors at 16,000 and the total medical doctors in Nigeria at 42,000. With those figures, the ratio of one doctor to one Nigerian is 1 to 4,700 Nigerians. And looking at a further breakdown of the statistics of COVID-19 exposure, infection, and doctors, death of doctors in Nigerian hospitals, including private hospitals, you will see that the Northwest is top on the list with the number of doctors contracting the virus. 92 doctors are infected, 47 alone at the Aminu Kano Teaching Hospital that is in Kano. You'll also see that in the South, we have about 56 doctors and 18 each have contracted the virus, 18 at the FMC Yenagoa, 18 also at Irua Specialist Teaching Hospital. This is a breakdown from the National Association of Resident Doctors as at July the 6th, with the statistics of the COVID-19 exposure, infection, and the death of doctors in Nigerian hospitals. Well, now let's join, of course, the president of the the Resident Doctors Association, NAD, Dr. Ali Sokomba. He joins us via Skype. We'd like to thank you for joining us on the program. While from our Abuja studios, we have Dr. Safia Ojo. She's a family physician. Thank you for joining us.
Thank you for having me.
All right, let's start with you, Dr. Sokomba, and this is with the information on doctors affected. It actually seems to be on the rise since we last spoke. Where exactly lies the risk?
Well, thank you very much for having me once again. You recall that since the outset of this COVID-19 disease in Nigeria, we have been clamoring that we need to do more prevent healthcare workers from getting infected. And to some extent, the government had lived up to that responsibility by providing the necessary personal protective equipment just at about the time we embarked on an industrial action. But the problem remains that these personal protective equipment are not reusable and they are consumable. So there's a need for that to be sustained. There's a need for sustained supply of this personal protective equipment. Unfortunately, this has not been the case in Nigeria. So we still are having some occasional scarcity of this personal protective equipment in our various hospitals. I am also glad to inform you that there has been some significant improvement in the training of healthcare workers with regards to infection prevention and control. So we are at this point clamoring that more needs to be done with regards to preventing healthcare workers from getting infected, and that will go a long way with dealing in ensuring that necessary personal protective equipment are sustainably supplied to our various hospitals. So I think if that is done, we'll have a significant reduction in the cases of this disease in Nigeria.
All right, let's get the view of Dr. Ojo, and this is in your capacity as a private practitioner. What do you think about the welfare of doctors, the medical healthcare personnel in the country?
Thank you for the question. Even prior to COVID-19 pandemic, the welfare of doctors in the country has not been really good. Even the healthcare facilities are not well equipped. There are no adequate financing of the healthcare sector. So the healthcare sector, even in the face of the pandemic, I think more should be done. Like talking about the personal protective equipment that are needed is mandatory. It's needed daily for caring for patients. So a lot is needed, even when supplied is not enough. And we still have centers that don't even have enough PPEs. So they are exposed daily to this virus. All over the world, we know that frontliners, doctors, and other healthcare workers we need to see patients, we need to treat them, but they need to be protected. More PPEs are needed. Everybody has to get the PPEs so that at least the risk of infecting the healthcare personnel being infected is reduced with adequate number of PPEs. And we know there are other problems, challenges we are facing in the health sector in Nigeria, even prior to COVID. Brain drain. A lot of doctors, even prior to COVID, left the country for better countries where they will be well taken care of. So even the doctor ratio, patient ratio is not interesting. So a lot has to be done. Now with the COVID-19 pandemic, some hospitals lack of adequate drugs in the pharmacy. They have to write drugs for patients to go and buy outside. And use of fake drugs will be much more available as a result of this pandemic. People also come even for other illnesses, to treat other illnesses in hospitals and are not even well taken care of because there are no PPEs to take care of these patients. So the welfare of doctors is paramount. When you're talking about combating COVID-19, PPEs has to be made available to every hospital, and every healthcare worker, personnel, should have a PPE to reduce the risk of transmitting of this virus to the healthcare workers. We know there's increased daily rising in the cases of COVID-19 in Nigeria, though we know that even the rules are not being adhered to. Social distancing and even use of face masks. A lot of people don't even use the face masks again. I don't know, at the onset of the COVID, they were doing their best, but now everybody has stopped using their face masks. Even the distancing, social distancing is no longer adhered to. Even the hand washing we're talking about. So the healthcare workers, their frontliners, they need to be well taken care of. They are facing a lot of challenges. apart from even the PPEs, they also have some psychological, some mental, because of the kind of patients they see daily, and even when they are seeing them and they have it at the point, at the back of their mind, that they don't even have what to protect themselves. So all those things are these things are paramount. The healthcare workers need to have all these facilities needed to take care of patients. And even the remuneration, all the promises that have been made, like talking about when you talk about hazard allowances, some doctors haven't still gotten theirs. So I think more should be done by the government if we want to combat this COVID-19 pandemic.
So essentially, it's really a long list, Dr. Ojo. Let's go back to Dr. Sokomba, and that is if you see an end in sight to all of the industrial action, the strike by medical healthcare workers in Nigeria anytime soon.
Yes. Well, I'm disappointed that the government does not seem to be interested in seeing to the end of industrial action in Nigeria. You recall that just about 4 weeks ago, we embarked on a strike which was suspended to be reviewed 4 weeks after. And immediately our strike was suspended, the government went to sleep. Everything that was supposed to be achieved during this period had remained on standstill, including the life insurance that we had so much talked about. And the moment the strike was suspended, the government went back to sleep, and we never got anything to hear from them since then. And brings to bear the type of government we have and their insincerity and unwillingness to see to the end of industrial action in this country. And I want to tell you that it is all in the hands of the government to see that industrial actions are ended in this country by ensuring that they play their part and remain sincere and committed to every promise they have made and see to their implementation. And that way, we will have no reason to continue embarking on one industrial action or the other.
All right. Finally, from you, Dr. Ojo, would you see an end to some of the industrial actions with regards to the medical healthcare workers? And what would your advice be to the doctors and healthcare workers who are on the front line? Very briefly, please.
Well, I can't really see an end to it, because we in this country, we are used to making promises that we don't fulfill. We wait until when they start going on strike before we start to do what they need for. So I don't see an end to it. So we need to change our mentality, how we tackle issues when it comes. Prior to COVID-19, we know the health sector has nothing to really write about, So we need to really sit down and think of what we should do. Proactive actions, not waiting for a pandemic to come before you want to put your hospitals in order or before you want to make sure PPEs are made available. I think we should, when promises are made, the hazard allowances and all that, they are mandatory. They should pay it to the health workers. This will even make them at least to do more, to have that at least, to show that it shows the people really care about them, and also think they also want to do more to society, try to treat patients, not when you don't even have what to work with. How do you work? You need to be alive to see a lot of patients. So I think I don't think there can be end to this industrial action if we continue to do this. If you're not really facing these issues that we need to, these challenges facing the health sector. So I think a lot has to be done. We know COVID-19, yes, a lot may actually go asymptomatic in 80% of cases, but a lot still come down with severe cases. How many ICU beds do we have in the country in case you have cases that require ICU care? So these are the things we need to put into consideration. Welfare of doctors and other healthcare practitioners, very, very important. I think the government should see to that.
We appreciate your time. Thank you so much, Dr. Safia Ojo, a family physician who joined us from Abuja. And thank you, National Association Resident Doctors President, Dr. Lee Sokomba. Thank you for joining us.
Thank you for having me.
You're welcome.
We have more on the COVID-19 updates when we return. Please stay with us. The WHO, under its Health Emergencies Program in the Northeast, has donated over 400,000 copies of information, education and communication materials to Yobe State government for awareness creation on the coronavirus pandemic. Making the presentation in Damaturu, the capital, the program manager, Dr. Colin Sowili, represented by the public health officer, says the materials are meant to inform the public on the disease and conduct a robust sensitization in communities.
WHO is standing by the Ministry of Health to ensure that the appropriate resources are provided and materials are also available to inform the public and conduct robust sensitization for them to prevent COVID-19 infection in their communities, in their workplaces, and their businesses, places of their business. So that is what we do. And in furtherance of that effort, we are donating these materials, constituting over 400,000 paper IEC materials. We are also providing materials for people to wear, and so that their families and their community members will be able to see what are the messaging for COVID-19. So that will improve their awareness, and then they will adopt behaviors that will prevent the spread of COVID-19 in the state.
Now, early evidence suggests that up to 1 in 5 patients with COVID-19 have signs of heart injury, regardless of whether or not they had respiratory symptoms. The high incidence of cardiac problems in patients who contract the new coronavirus have perplexed medical experts. And we have an expert here, Professor Wale Oke, the head of cardiology, one unit, Lagos University Teaching Hospital, and also College of Medicine, University of Lagos. He joins us on the program. Thank you for joining us today.
Thank you very much.
All right. One of the key problems associated with COVID-19, we've been told, is the inflammation, the infection causes. But do we yet understand or know the full impact of the virus on the heart?
Yeah, we do know the impact in an acute situation where the patient goes into heart failure or may have a heart attack and subsequently die from the... But mind you, it's a vicious cycle comprising of the major organs of the body that is affected, the heart, the lungs. Some people are now reporting strokes occurring in patients with, and the kidney, of course, the brain. What my fear is what is going to happen in the future. Yesterday, I read a report that patients who suffered from COVID 6 months ago still had viral particles in their blood. Children are having it, and a lot of them are asymptomatic. But do they have the particles in their heart? What happens in the next 2 years? Is there going to be a chronic cardiac manifestation of COVID? And indeed, I believe we will soon be studying and researching on the effects of COVID on the heart in 3, 4, 5, 6 years. God forbid if another virus comes in. So we really don't know what's going to happen.
I was going to ask, what are the dangers of having viral particles in a very important organ?
Yeah, you could have it, and it could just smother on slowly and steadily until eventually something manifests. My fear also is for the athletes who acquire Djokovic acquired the infection some time ago. He's on, I think he's still self-isolating, but he will go back eventually to playing tennis. We don't know what's going to happen. We don't know what the dynamics or the damage the virus has done to the heart. So, and the children have it, they are running around all day. So we really don't have a solution to that, or an answer to that. But we'll just have to learn as time passes.
And try to prevent it, especially for those who don't have it. There was a recent study that talked about the relationship between the COVID-19 pandemic and stress cardiomyopathy. They says it's a condition people call broken heart syndrome.
Well, I'm not aware of the romantic broken heart syndrome part, but the common nomenclature is dilated cardiomyopathy. And what happens actually is you have a diseased muscle. You know, the heart is a pump, and the more effective it pumps, the better the job it does. In dilated cardiomyopathy, the heart becomes fibrotic and lax. So it's unable to actually pump blood. And patients like that would often go in and out of heart failure, okay? And then when you have a compromised lung, you can't get aeration. The myocardium is starved of oxygen. It's a vicious cycle. It just goes worse and worse. Eventually, the patient may die from heart failure. That is irreversible.
In terms of COVID-19 affecting the heart, in terms of severe cases, those perhaps that have underlying illnesses?
Okay, in severe cases, actually, what happens is once the virus gets in, replicates, the body mounts an immune response against it. For those who are asymptomatic, they're able to mount adequate immune response so they don't have any problem. And it gets worse with a falling degree of immune response. But the really severe one go into serious heart failure when they develop what we call the cytokine storm, where the body overproduces antibodies, which damages the virus, but also damages the heart muscle itself. It's like what happens in acute rheumatic fever, where the body recognizes a part of the bacteria that invades and damages the heart. But in this case, it will be severe. And there's nothing, we don't know if this is going to be an ongoing slow process in some individuals. But
can they recover?
They will recover, but if some of them will recover, definitely. A lot of them will die if it's acute enough. That's why steroids has played a very good role in the treatment of, because what steroid does is to control the rate at which the body immune response engages the virus.
So in terms of keeping our heart, lungs, everything healthy, what do we need to do?
In this COVID era or generally?
Especially
in this COVID era, safe distancing. I watched CNN today, and there was a report on an outbreak of an attack coming from a COVID-19 party. Can you imagine it? People actually had a big party. And I'm sure it's happening in Lagos as well. Control your blood pressure, consume less salt, engage in active exercise, maintain a good, adequate weight. That should do. If you do that, everybody will look like you.
And you as well. We'd like to thank you, Professor Wale Oke, Head of Cardiology 1 Unit, Luth College Medicine, University of Lagos. Thank you for joining us on the program.
Thank you very much for asking me to come.
Now, Spain's King Felipe, along with other politicians and EU members, have paid tributes to the country's nearly 30,000 victims of the coronavirus. The ceremony is also to honor frontline workers who continue to fight against the pandemic. Here's more on our global update.
King Felipe, Spanish politicians and health workers for the socially distanced ceremony. About 400 participants came to the Royal Palace in Madrid, seated in concentric circles around the flame. People wore black face masks and placed flowers around the fire. Meanwhile, Brazilian President Jair Bolsonaro has again tested positive for coronavirus, suggesting he has yet to recover from an infection first diagnosed last week. Since catching the virus, the president has said he remains in good health and he would resume his normal work schedule if he tested negative this week. He is expected to get tested again in a few days. South Korea has reported 61 new cases, a sharp rise from 39 infections a day earlier. The country's health authorities say the infections were imported from overseas, including a group of South Korean construction workers who had returned from Iraq. Australia's second most populous state of Victoria has reported 317 new cases, the state's highest one-day rise in infections and the country's largest since early April. Victoria has been isolated from the rest of the country for more than a week following a fresh outbreak of the disease for essential businesses.
For more information, you can log on to our website, channelstv.com. That is www.channelstv.com. It has the latest news. All you need to do is see all of the stories coming in. The latest on the pandemic, you can see there on our front page, the numbers across the country and other stories as well from Nigeria, Africa, and the rest of the world. From the World Health Organization's website, your questions are answered on the coronavirus disease situation. You can also take a look at the latest global numbers by country of COVID-19 cases on a daily basis. It has several other regulations, and you can take a look at the numbers in real time. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Bye for now. Stay safe.